This medication is commonly used to treat many different types of bacterial infections. It can also be used to prevent infection of the heart in patients with specific heart conditions who are undergoing surgery. This medication is a type of natural penicillin antibiotic, and it works by halting the growth of bacteria. The dosage and timing of this medication will depend on the specific infection being treated, so it's important to follow the instructions of your healthcare provider. Always take this medication as directed and never take more than the recommended dose. If you have any concerns or questions about this medication, be sure to consult your healthcare provider for more information. When using penicillin G sodium vial, the medication is typically given by injection into a vein or muscle. It's important to follow your doctor's instructions carefully. The dosage will depend on your medical condition and how you respond to the therapy. For children, the dosage is also based on their weight. If you are administering this medication at home, make sure to learn all the preparation and usage instructions from your healthcare professional. Before using, check the product for any particles or discoloration. If you notice either of these, do not use the liquid. It's also important to learn how to store and safely discard medical supplies. If you are taking aminoglycosides, such as gentamicin, be sure to give them separately from this medication. Do not mix them together in the same fluid. To get the best results, use this antibiotic at evenly spaced times. Try to take it at the same time every day to help you remember. It's important to continue using this medication until you have finished the full prescribed amount, even if your symptoms improve after a few days. Stopping the medication too early may cause the infection to return. If your condition persists or gets worse, be sure to inform your doctor. Some common side effects at the injection site include pain, redness, and swelling. If these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, if you do have any serious side effects, such as joint or muscle pain, muscle weakness, swelling of ankles or feet, dark or cloudy urine, extreme tiredness, irregular heartbeat, signs of infection, easy bruising or bleeding, signs of kidney problems, numbness or tingling, seizures, uncontrolled movements, or confusion, it's important to contact your doctor right away. If you are taking this medication to treat certain infections, it may cause a reaction known as Jarisch-Herxheimer reaction. This can occur shortly after taking the medication and can last up to 24 hours. Notify your doctor immediately if you experience symptoms such as fever, chills, muscle pain, worsening of skin sores, fast heartbeat, fast breathing, dizziness, or flushing. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. If you develop symptoms such as persistent diarrhea, abdominal pain, blood or mucus in your stool, it's important to contact your doctor right away. Do not use anti-diarrhea or opioid products as they may worsen the symptoms. Prolonged or repeated use of this medication may result in oral thrush or a new vaginal yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms. A serious allergic reaction to this drug is rare, but if you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using penicillin G sodium vial, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as your medical history. This medication may also interact with other medications or dietary restrictions you may have, so it's important to discuss these with your healthcare professional. It's important to note that penicillin may affect the effectiveness of live bacterial vaccines, so be sure to inform your healthcare professional if you are planning to have any immunizations or vaccinations while using this medication. Some forms of penicillin G sodium vial contain sodium and potassium, so if you are on a salt-restricted diet or taking potassium supplements, it's important to consult your doctor or pharmacist before using this medication. It's also important to note that older adults, newborns, and infants may be at greater risk for side effects while using this drug, so it's important to use it with caution in these populations. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using Penicillin G sodium vial with your doctor before starting this medication. It's important to be aware of potential drug interactions that could affect how your medications work. This includes prescription and non-prescription drugs, as well as herbal products. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. Some products that may interact with Penicillin G sodium vial include blood thinners like warfarin, methotrexate, NSAIDs like aspirin and indomethacin, and tetracyclines. If your doctor has prescribed low-dose aspirin for specific medical reasons such as heart attack or stroke prevention, it should be continued at the prescribed dosage. It's best to consult your doctor or pharmacist for more details on this. It's also important to note that this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform the lab personnel and all your doctors that you are using this drug. If someone has taken too much Penicillin G sodium vial and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include seizures, confusion, and changes in mental or mood. If you or someone else has taken too much of this medication, it's crucial to get help right away. You may need to undergo lab and medical tests, such as kidney function, complete blood count, and potassium/sodium levels, while using Penicillin G sodium vial. It is important to attend all your medical and lab appointments. Make sure to consult your doctor for more information. Remember, it's crucial to take each dose of Penicillin G sodium vial as directed. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to determine the best course of action. And whatever you do, do not take a double dose to make up for the missed one. Be sure to consult the product instructions and your pharmacist for storage details, and always keep medications out of reach of children and pets. Avoid flushing medications down the toilet or pouring them into a drain unless instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. Consulting with your pharmacist or local waste disposal company is recommended. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.